I guess one thing that always comes to my mind when I think about things that I wish I knew is that we come in as medical students and we feel like we need to always be doing something. Like we feel like medical school needs to be like the all-consuming thing in our life. There was a lot of times where I felt like I had this pressure on me that I needed to be doing extra research or extra studying. And I think that that's something that I wish I didn't walk in here with because it caused a lot of unnecessary stress at the very beginning when there didn't need to be any stress. And I guess the second part to that is that I think people feel like they need to kind of cut back on other parts of their life in order to make room for the big beast that medical school is going to be, where it shouldn't be the only thing in your life. If your only focus is going to be on like the science and like being a medical student specifically, you're going to lose the other parts of your life that, well, for one, like might have gotten you here in the first place. Like you don't want to lose track of that because then you start losing yourself as a person, and then that's when you get consumed by it. And I think that's something that I wish I'd known coming in. It's something that I've been constantly working on and trying to maintain as like a tenet in my mind, as like a core piece of me. Just like all the things that aren't medicine, I think are really important.
So one thing I wish I knew a lot more about what advocacy in medicine looks like. Even as a medical school student, there is so much that you can do to push forward the needs of your patients and the needs of communities that you care about. I think coming into medical school, I thought that there was a lot of medicine that I would have to learn before I could do any of that sort of work. And yes, as a physician, there is a lot that I'll have to learn in order to be able to treat patients. But as a medical school student, there is so much room to do advocacy, to write op-eds, to push forward legislation, to lead initiatives, to run protests that will help to make sure that the needs of disadvantaged communities are being met. And so what I'm trying to do, and my advice to any medical school student would be to find out what it is that you care about. Find out what communities you want to serve. Find out what sort of work you want to do as a physician. And then find ways to start doing that right now.
Hi, my name is Ashley Kalwazi. I am a third year medical student in the Pathways curriculum here at HMS, and I plan to apply in internal medicine, and my academic interests currently are within cardiology. Extracurricularly, I'm interested in research that focuses on the intersection of health policy, healthcare disparities, and clinical outcomes. And I enjoy playing sports and hiking in my free time. I think one thing that I wish I would have known a little more prior to coming to medical school is just how fast-paced the curriculum can be. And I probably would have traveled a bit more prior to coming to med school, but there's definitely still time to do so.
To ask myself what is influencing or potentially fueling my interest in a particular thing, or why do I feel that why do I need to do research, or why should I be involved in X, Y, and Z extracurricular, and trying to always have that filter through the priorities that brought you to HMS or brought you into medical school, as opposed to the priorities that you're being told are now important that you've arrived in this environment. I think as people differentiate and sort of like find their niche, or however the process happens in between medical school to residency to fellowship to your career as a clinician or attending, I think that you're always being pulled in these by these social forces of the academic centers that we work in. And I wish that I could have told a younger version of myself to just spend a little bit more time alone thinking about them, because you can't tease them apart when you're in the midst of all the pulls. If you get here and then you start, like you said, looking around outside of yourself to gauge like, am I doing well based on like the cues I'm getting in my environment, which is probably like just the default mode that probably got all of us here. to begin with. But if you still keep doing that here, I think that it's a recipe for disaster and a recipe for forgetting like what made you special that brought you here to begin with, because you're now trying to make yourself like other people to conform to this place. But obviously all of this is much easier said than done. But like, second piece of advice I would have given myself is compare yourself to who you were yesterday when you went to bed and who you're going to bed as today in terms of like your skill set and your progress and your discipline, instead of any number, score, person, affirmation that comes from outside. It should only be based, like, the answer is within you and nowhere else, kind of, to use the expression.